If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
Okay, welcome to Health Further. We are without our fearless leader, Marcus Whitney, today, but I have a great stand-in, Emily Evans. Thanks for joining Health Further. Appreciate it.
Glad to be here. Very excited. I want to tell everybody that I had eye surgery, so I did not get into a street fight. I hope next time I appear, I look a little better.
I think we will choose to sort of value you're beautiful and intelligent, and we'll have to just focus on the intelligence and policy and regulation details in this episode.
Okay, very good.
Yeah, so Marcus is out, but it's great because there's a lot of policy going on this week, and we have a lot to talk through. So let's dig into the stories. Okay, starting off with the economy. The Federal Reserve held their meeting yesterday, and they came out with no changes. Emily, what do you think of this story?
We have been talking about this a lot at HedgeEye because one of Jerome Powell's biggest problems here is that he really firmly believes that the Fed is in control of monetary policy and the and interest rates and all these things. And they're so far behind the curve, when it comes to actually understanding the economy and the speed at which it moves. But nobody can give up the idea that we have this independent Fed that does the right thing all the time. It's a myth, right? But as Keith McCullough, our CEO, put it, he goes, the thing about Jerome Powell is he's irrelevant, increasingly so, in a dynamic, multipolar geopolitical world. But he's relevant because people think the Fed is a big part of what sets economic policy in the U.S. It's
if you believe that the Fed makes a big difference and then you trade on that belief, then in fact they do make a big difference. Because everyone is trading around that. Right.
But if you look at what the bond market does in response to what he says, it's fairly clear that it does not value his opinion. And the bad news here is that interest rates are being held unnaturally high. And you see this with, new home sales are at a 20-year low. And it's because people are expecting interest rates to get set lower, and they're not because of these kind of crazy ideas like tariffs cause inflation. I mean, there is years of history and research on what tariffs do to inflation. Taxes don't cause inflation. Government spending causes inflation. And so he keeps saying these things, and he's relevant because he's the head of the Federal Reserve, but he's not relevant because of the world in which he is operating is increasingly ignoring. I'll be very interested to see how the position of our central bank persists over the next 10 years. I'll be interested to see how that goes.
Yeah, what I would say is that the U.S. dollar is still the reserve currency for a big percentage of trade, and
the most important trade, energy trade,
and the oil trade, and Jerome Powell and his successors are the biggest influence on the bond markets, although that influence is declining dramatically because we're in fiscal dominance. I mean, Marcus and I have talked about that, but as you have more and more debt owned by the Treasury, there's less of an impact by the Fed policy.
Right.
I'm sure listeners are tired of me talking about, but I think all the AI and technology is very deflationary. And I know there's an oil shock and a war going on right now, which will be temporarily maybe cause gas prices, oil prices to go up. But in general, I'm much more concerned about jobs on the two-sided mandate than I am on the inflation side of things.
Yeah. Well, the inflation seems to be more occupying his thinking than anything else. And I think that's a mistake. And, yeah, there's a war going on, but, look at the forward contracts for oil. They're not worried. This is, and Jerome Powell's not looking at, he won't look at those things. He cannot, they cannot get flexible in their paradigm. They're doing what economists have been doing for 100 years, which is, building models on retrospective data, and making forward judgments on that. And that works in a very stable environment, say from 2000 until 2015, 16, but it doesn't work when you have what you have right now, which is a much more dynamic, multipolar, geopolitical world, with the U.S. changing its position vis-a-vis its allies.
Okay, so we'll see how the economy holds up. Hopefully it'll be okay. Moving on to the venture markets. We have one big deal this week to talk about because I think you know a lot about it. So Turquoise Health raised $40 million from Oak and several other VCs, I don't know. And it was a Series C funding. They started life as a cost transparency service. That's how I thought of them.
Right.
And now they're evolving. It now says a healthcare pricing and payment platform is the phrase. Have you talked about this? Because you are a co-founder in Transparent Health that I think is at least adjacent or maybe competitive. So how do you think about this big new round and Turquoise they had a lot of money before this round. They have more money now.
Pointing out that I believe the investors in the C round are the same investors as A and B. So kind of hard to tell.
Oak had come in newly.
Are they new? Okay.
I think Oak is new, but yeah, Andreessen Horowitz and Adam Street,
That's I guess the first thing to point out. The second thing to point out here is that they are making a pivot away from just price transparency, making that data available, making it actionable for consumers, and encouraging, people to understand what stuff costs. And they're really moving towards, we're going to rationalize things between payers and providers. And we're going to, make sure that and we're going to have the contracts, and we're going to be able to see exactly, high visibility into what you can and cannot do, and how much you're being paid, and so forth. And I see a fairly important issue here, which is the healthcare industry is so sclerotic that it has, you have to pick a side. You are either on the payer side or you are on the provider side. And if you are trying to play both sides, which is what it looks like they're trying to do here, you're just going to make everybody mad because the dollars are finite. And, and if a payer wants to pay less for service A, then that provider gets paid less. They have less money.
If they're brokering that transaction, and they are going to have to pick a side, essentially, and try to make it best for their customers. And if their customers are on both sides of the transaction, I agree. That's going to be a very difficult customer service.
And we're seeing this with United Health. They have this fleet of physicians and, surgical care affiliates and so forth. They put themselves on both sides of the transaction, both the insurance side and the payer side. And it's caused them a lot of problems. And we'll probably have to, we'll probably be seeing some divestiture as well. Now, one of the things, and the Transparent Health, which you mentioned a few minutes ago, what Transparent Health is trying to do is position itself on the side of the consumer, because those are the people that are paying for the stuff, and in an irrational way. The cost of health insurance doesn't make any sense when you look at the value of the negotiated price that your insurance company secures for a particular service. You especially if you're healthy, and you don't need a lot of healthcare. This will be kind of interesting to see how it goes, but I have a sneaking suspicion it will be difficult to navigate those waters in a deflating environment. I mean, healthcare is in a deflationary environment. They're after really 20 years of just pouring money into it. We're not pouring money into it. Even if we just pour the same amount of money into it, the rate of change in the growth in money going into healthcare is flattening out.
That's a huge point that I don't want to gloss over. So we spent $5 trillion last year as a society on healthcare. And I think what you're saying is that the growth in that 5 trillion to 5.2, 5.4, 5.6 is going to slow, or in fact, perhaps even it will go down, which I haven't seen in 26 years. I've never seen it go down.
Yeah.
But eventually
it's mostly going to slow. The area of 8% year-over-year growth is mostly in the Medicare. Why? Because that population is getting into its high utilization years, that boomer population. But it's definitely decelerating and flatlining into a 3-4% growth rate. But compare that to 21, 22, 23. Those were just enormous growth rates. So that's coming down. And dollars are coming out of the system, and whether they're coming out of the system because of utilization, because of lower provider payments, or fraud, the amount of money getting spent on in non-productive ways, that is happening when your system's deflating and everybody is trying to take their piece of the pie. It gets kind of ugly. Right.
So Turquoise trying to create a new settlement layer or price contract payments. I think that a settlement or revenue cycle. There's a lot of people in that space. And two, as we get smaller or grow more slowly, that's going to be difficult for all sides. And I want you to talk about transparent and how you said you're aligning with the consumer. But how, or what does that mean?
So our premise here is that for the vast majority of the volume in healthcare, which is generally commoditized services, imaging labs, E&M visits to docs, those sorts of things, plus, colonoscopies, mammograms, whatever. The vast majority of that care is not really insurable. The value, the price that your insurance company negotiates for the cost of the premium. So you may spend $1,200 a month in premium, and you save maybe $100, in healthcare services in the course of the year. That's not really a economically viable approach. Meanwhile, 20% of your wages, are going to health premiums. When instead of, going in your pocket. So our thesis is that a lot of healthcare can be delivered in the cash market and should be delivered in the cash market, and health insurance should be reserved for high consequence, events like, cardiac surgeries, cancers, even maternity. I think I could make a decent argument for maternity. But in order to get there, in order to have a viable cash market, you have to have a cash price. You have to have people that will honor that cash price. And so what we have built, and we've got a MVP out, what we've built is a way in which you can identify cash prices for providers in your neighborhood, and then make a decision based on that.
Let me stop you and make sure I'm understanding, and maybe see if an analogy makes sense to you, because I think in kind of analogies. And so health insurance covers kind of everything that you ever do interacting with the healthcare system gets paid for by insurance, even things that are very predictable, like my statin medication, for instance.
Right.
And
mammograms.
That is mammograms. Yes. Mm-hmm. And it's similar to like if you have homeowners insurance. I mean, we just had a big storm in Nashville and a shutter on my house fell off. And so, I'm not handy enough to do it myself. I had to pay someone to come do it. It cost me $70, but I don't file an insurance claim for that. No. I do have homeowners insurance, but it is sort of generally understood that there's a high deductible. And if something significant happens, a tree hits your house or something, a fire, there are certainly times you would claim, but they're typically unpredictable and large, such that it would be really difficult for an individual to sustain that payment. Therefore, it's willing to offload that risk and
Right.
pay some insurance. Even though I'm not going to likely have a fire in my house, I have coverage that would cover that. And of course, the bank wants me to have that in case, because they have a loan on it. Is there analogy in healthcare? Like there's a bunch of maintenance things, right, that you wouldn't.
Yeah, that's exactly right. Somehow we've managed to convince the American public that everybody's an edge case. You know, every single person out there is going to get cancer. Every single person's going to have a major cardiac event, and you need to pay, you know, boatloads of money into the system in order to, you know, have that protection when the time comes. And that was an okay argument, I guess, when we were all paying $500 a month for family coverage. You know, like
Okay, before chronic disease. I mean, chronic disease was not the biggest driver of cost in the 90s, even
right.
lately.
We could say, okay, yeah, I'm all right. You know, we don't do the math. It's fine. Your employer takes care of it. But now you're giving up. And if you're a young person, this is terrible. You're giving up 10 to 25% on my math of your wages to your health insurance premiums. So that's coming out of your pocket. That's going into the insurance company. And you get very little benefit. Maybe you spend $300 a year, you know, but you know, maybe you spend $1,000 a year. If you're very responsible, you get a mammogram and you do all these things, but maybe you don't. And that's why you see really low uptake in health insurance for low skill, low wage industries like hospitality. They simply can't afford it. You know, they're just not going to do it. I need my wages.
So transparent you would get some catastrophic care. You'd be covered for a car accident or a cancer or something that would be significant.
Everybody should have health insurance.
Yeah, but it would be some kind of catastrophic care or what used to be called major medical when I was growing up. I don't think we have that anymore. So do those plans exist out there?
The Trump administration is doing some work to make those possible. They exist in Tennessee through the Tennessee Farm Bureau, which has got non-regulated health plans. You know, there's some other tricks in the trick bag, short-term plans and so forth as well. But I think one of the policy priorities, and we'll get to this in a minute, is to liberalize the high deductible health plans and to expand the HSA policies because you know, if you're the president and you're really trying to get wages up, you want more money, disposable income in people's pockets. A very obvious thing to do is to liberalize the health insurance markets and get people away from it.
I'm okay with high deductible plans. The co-insurance, though, is really hard. And so I think we need to try to teach people what co-insurance is and limit it from these catastrophic plans.
Yeah, there's a number of Cigna, which is a company I have never been a big fan of, but Cigna has been pioneering a lot of insurance products, different stop loss products and so forth that have more flexibility. They're doing it primarily in the employer market, but that's the kind what you hope you get to is that people start going, okay, I'm going to buy this, like your house. I'm going to buy this house insurance policy because my house is worth this. My house is this old. My house doesn't have a sprinkler system. You know, whatever all those factors, you know, that go into deciding what you should buy in terms of homeowners insurance. Same thing for your health, right? You buy what you think you need. And that's kind of where the policy direction, but it's fraught with politics, which we'll get into here in a minute.
Okay, so that is turquoise and transparent. Transparent hasn't raised as much money yet, but maybe soon.
No, but they have high quality investors.
Yeah, we are trying to invest right now. It's not fully done. I had to change the contract team, but I think we'll get there. So
Okay.
by the next show, I think we'll be an investor. Okay. Yes. As you were saying, Democratic senators detail plans to take on big insurance, as described here in Fierce Healthcare. You've been following this in the Finance Committee. And
Yes.
then also was another committee, Energy and Commerce, I think, this week. So tell us what's happening in Capitol Hill around this.
Yeah, so the dynamic here is that we have midterms in the fall of 2026, and it's looking like it's going to be tight. The Senate will stay Republican. I don't think there's much question about that. The House is very much in play, and so in that political dynamic, you have a few problems. The public is getting very weary of the high cost of everything. And the inflation issue is receded, which is great, but there are other issues, education, healthcare, that continue to persist. So there's a lot of pressure to kind of solve this problem, or at least offer some solutions ahead of midterms. In doing so, House Republicans have a problem, which is anything they say that's new or different is going to get attacked as ripping away people's health insurance, or supporting junk plans, or what have you. Democrats are trying to make sure they don't cede this issue. For Democrats, health care is their issue, so they need to come up with a plan or policies that take control and don't cede it. So it's this little balancing act where Republicans, and especially on the House side, are trying not to say anything too crazy that might attract negative attention going into the election. And Democrats are trying to make sure they don't have any real influence over the policies. But within each party, there's a ton of disagreement, and Democrats have a bigger problem with disagreement than Republicans. Republicans are famous for never really wanting to be involved in healthcare. So they just for 40 years they've always been like, don't like it.
Yeah.
Let's talk about tax policy and defense. But Democrats, want to make sure they continue to own this issue, and this is what Senator Wyden is doing. He sent out a dear colleague letter saying, "Hey, dear colleague, this here, I want you, bring your ideas to us so that we can shape up a policy ahead of 2028. The letter doesn't name any specific policies, but it definitely points the way towards Medicare for all, and that's why that headline, "Take on Big Insurance." But it also has some minor policy ideas like getting rid of what they call junk plans. These are plans we were just talking about, catastrophic plans and
the plans. One person's junk is another person's ideal.
This
plan.
is the problem. Yeah. This is the problem, right? So that's the dynamic. The House Energy and Commerce Health Subcommittee had a hearing yesterday, and it was kind of clear that we're not going to do much when it comes to disrupting the status quo. They had the American Medical Association there. They had the American Hospital Association. They had a trade group from the big self-insured plans like Microsoft and FedEx, and they were offering policy prescriptions that we've been listening to literally for 20 years, and those are revive physician-owned hospitals, end consolidation, stop vertical integration. None of these things are major factors in driving costs in healthcare, and especially hospital expenditures, which either means they don't understand the problem, which is possible, or they're trying to stay away from the stuff that's scary and new and different, like expanding health savings accounts, like reducing the mandates in the Affordable Care Act for health plans that would allow more liberalization of the product offerings that are out there.
So is it fair to say that we're going to hear a lot of noise, a lot of stump speeches, we're going to take on big whoever, but not a lot of actual change between now and the midterms, which is
the one thing that I am not sure of, we will have to see, is that the White House has said, all right, we want an answer to this affordability in healthcare. That could set up, that probably will set up a reconciliation bill. And in that bill, I am expecting something like an expansion of the health savings accounts. The president keeps saying, don't send money to the health insurance companies, it's kind of like he's saying, send it, just pay for it yourself out of an HSA, which of course is the cash market we were just talking about. He's also said, we need to have more flexibility in the plan offering. So that could be part of reconciliation as an option. What they really need to do is get rid of the employer mandate, but I think they probably won't because of political considerations. But those are the kinds of things I think they're going to.
The employer mandate and the tax benefits, sort of both would be.
It's funny, the tax benefits have not. They never grow. It's the same number year in and year out. It's funny. And I don't know why employers are so attached to it, but it's about 250, 60. It always fails to grow according to projections, but 250, 60 billion a year is the tax expenditure. But the employer mandate is tough because you have to offer your employees a affordable health coverage. Affordable health coverage is defined as, about 9% of household income. And that can be, first of all, that's where you are on the wage scale. 10% of your household income is asking a lot anyway. Yeah. And if an employer does not offer Affordable Care Act and that individual goes out onto the exchanges and buys insurance, then that employer is penalized. That's a bigger headache than anybody wants. And it's something that it keeps employers from really offering, some flexibility. That's what they need to do. I don't know if they're going to do it, but that's probably what they need to do if they're worried about affordability.
Now let's go to the vaccine policy. We have 3 or 4 stories. Federal court blocked RFK Jr.'s U.S. vaccine policy. I believe this is going to be appealed and overturned relatively quickly, but and so that's the next story. New York Times saying, exciting, but it's going to be short-lived. Tell me about that. Tell me about this.
Well, it's a stupid lawsuit. They went through all the steps, right, to define a new policy. They appointed new people. They did all these things, and some people don't agree with the new policy. The new policy is a lot less prescriptive. It's a little more. Hey, here's some ideas. Talk to your doctor, which is the way the system worked for a very, very long time. But a lot of people don't like that. So there was a lawsuit. It will get. I actually saw a tweet from one of the doctors on it that they're going to disband ACIP, which is the CDC's advisory group, and reconstitute it, rather than go through an appeal process. And that way they nullify essentially the court decision. The importance of the vaccine policy is that Make America Healthy Again is a very important coalition within the Trump administration and within the Trump White House. It has to be kept happy. It doesn't have to be given everything it wants. It just has to be some evidence that the White House and Secretary Kennedy are sympathetic to these, frankly, longstanding concerns about the child schedule, about food, about social media use, you name it, things that have made raising children, for the last 20 years, just the most miserable experience imaginable.
So the direction is not really going to be changed. A judge overturned it. It's going to be appealed. We're going in the same direction, basically.
Yeah, I think so. And keep in mind that the preserving the MAHA policy is fairly critical here.
Okay, and then in the Wall Street Journal, HHS has a potential solution for cancers that keep coming back. So cancers often will return, even you you get into remission for a period of time, and then they return. And this article is saying that vaccines show promise for that through kind of immunotherapy. You know a lot about this, so talk about. Is it even a vaccine? Should we even be calling it? I don't know what that means to treat a cancer that is already present.
This is Moderna's innovation. Let's call what is essentially an immunotherapy, let's call that a vaccine, which is uncomfortable because when you call something a vaccine, you give it a special legal status, in terms of product liability on the child schedule and a few other things. So it's not an innocent, piece of nomenclature there.
Right. It benefits the company that is bringing it to market. It protects them.
Right. Exactly. So HHS is say, okay, we've got this partnership. We're going to see if this works. The data up to this point has not been super encouraging for quote unquote vaccines or genetic immunotherapy solutions to stop cancer. I think there was a decent readout in one of the GI cancers. I can't remember which one, but it's still this. I think there might be a little too much hopium here for most people, which is of course a huge problem at the Wall Street Journal, the New York Times, and every media organization that picks up a headline like this.
So now let's move to CMS's access program. There was not news about this week, but when we had you filling in for Marcus, I thought it was a good chance. This was a huge policy initiative to get rolled out in December.
Right.
And I think it's going to really be influential in healthcare policy for years. So maybe frame it up for the listeners, and then what does it mean to providers, to payers, to entrepreneurs, to investors?
Right. So one of the problems with healthcare up until the Apple Watch, I guess, is that your doctor gets a point in time piece of information about your urinalysis, blood pressure, heart rate, et cetera. Which is influenced by a lot of external factors, like you're sitting in the doctor's office,
people's heart rate might be elevated.
Yeah, you're nervous, and there really hasn't been a full embrace of all of these remote technologies, all of these wearable technologies, to better understand the patient's care. And I mean, I use a blood pressure monitor called CardioArm, which is connected to my phone with an app, and it takes my blood pressure because my blood pressure is too high. It takes my blood pressure, and it's great. And I take it to my doctor, and I'm like, "Well, here's the
whole last 3 months or whatever."
Yeah, and he's like, "What?" I mean, and by the way, he fully embraced it. He bought one himself and he recommended it. Okay, so victory there. But the point being that the medical community, they're not trained that way, right? They're trained to take your blood pressure, when you come into the office. So that's the paradigm shift that this access program is trying to encourage, which is, all right, let's get these wearables, let's put that Fitbit on or that Apple Watch or whatever. And there is some controversy with the FDA about whether or not these devices are really giving you good information. But let's just accept the fact that they'll work that out, and we'll end up with good information, or the doctor will end up with good information. You have two things in this model that I think are useful. One, the doctors now have a pathway through this model to go, all right, let's look at all those things. Let's monitor that blood pressure more frequently at home. Let's have that information so that we can, when the patient shows up, we're talking about those things. We're not just, doing all the vital signs. We're actually talking about, okay, what did you do this day that, made your blood pressure go up? So that's the first thing you get. The second thing, and this is less appreciated, but I think this is a massive trend in healthcare, and that's that you get people plugged in and interested in their health. Okay. They're like, oh gosh, my sleep score on my Fitbit, was only 78. And you've got this very subtle behavior modification going on there, and you've got a feedback loop. So this is a cool program. I think, because Secretary Kennedy, made this a priority. People have been a little dismissive, which is unfortunate, because this is a great way to think about healthcare, and it solves a ton of problems, right? It solves a labor problem. You don't have to go, if your blood pressure can be remotely monitored and you have high blood pressure and the doc can see what you're doing, you can spend less time going to the doctor. These are all the knock-on effects. I'm hopeful that that it's a model that can be quite successful.
And there is reimbursement for the docs and for the wearable providers in order to incentivize them to do this.
Right. Eventually what you hope you get to is that those fees get folded into, like an E&M code. Like, you've got a E&M code that allows you to bill for all of those things, or maybe it's associated with the E&M, whatever. But it provides a critical part of it, which is a funding source. It provides some guidance and structure. The FDA is liberalizing and has liberalized a lot of their policies with respect to wearables, and it'd be a paradigm shift.
And it's a 10-year program starting in July, like right now. And so applications to be included are due, I think, for April. Okay, so that covers the policy. Let's move into health systems. One pretty big story this week, and this is from Healthcare Dive, Sutter and Allina Health to form a $26 billion nonprofit system. So Sutter, of course, is in California. Allina is in the Midwest. Yeah, like right. Minnesota, Wisconsin, kind of there. I think it makes all the sense in the world. I'm excited for this deal. They both need to be larger.
And they're jumping geographies. Sutter's jumping the geography, so they're not.
Right. That makes it more likely to be approved, I would think.
It does. It should. I'll just caveat it with there's, after that hearing yesterday, consolidation is this big, bugaboo in driving price up. It's not. I mean, you can't see that anywhere except anecdotally, but that you might get there might be some heat on this as a result of that.
Yeah, maybe there will be. I think it's more of it's required to keep them both healthy. And so I don't think it's going to drive prices up. I think it'll allow access to continue in places where that's needed. Yeah,
I agree with you. I mean, I think the consolidation argument is first of all defeated by the data. If you look at, if you look at healthcare prices in Nashville, which has 3 huge systems within a half a mile radius. And then you go look at a monopolistic geography like Western North Carolina. Sorry, no difference. No, it's not. So blame being assigned to consolidation just really doesn't show up in the data at all.
Yeah, so I'm excited about this. I don't know if it will get through the approval process, but I think it should. Okay, moving into the About Health and Us category. There's a pretty good, a little bit scary article. She hoped ketamine would rewire her brain. It's in the Wall Street Journal, but she didn't live to see it work. It documents one woman's experience with ketamine. Unfortunately, she passed away. But what I was really struck by is this graph for people that are watching on YouTube. This is the annual ketamine prescriptions in the United States, and it's bumping along, at 20,000, 30,000, sub 50,000 since 2018. Jumped up a little bit in 2022, maybe. But then in 2025, it's at over 500,000, 550,000 prescriptions, so it's a 10x increase.
Yeah.
And I think it's pretty scary. I mean, ketamine can really help people, but it's a powerful narcotic. It's a powerful drug. It needs to be managed well. And I'm not sure that all of these prescriptions are being managed really well. Certainly this story is a scary example.
Psychiatry is basically become a drug pushing industry. And the stories being told, whether it's ketamine or we've heard lots of stories about the therapeutic effects of cannabis. The research on this stuff, because they are controlled substances, is really thin. That it's
you weren't allowed to research it for a long time.
You weren't. You couldn't do it. And it's this hopium. This poor woman, wants to rewire your brain. Like you don't need to rewire your brain. That's not a scientific way of approaching a serious psychiatric problem. But these things show up. I mean, these solutions show up. They run way ahead of actual medicine and the science. And this is what you get. And it's really unfortunate. Cannabis has done it, and ketamine has done it, and the psychiatric community is in bad need of really kind of a reset on how they approach drugs generally, because there's, the science and the research coming out on, the gut biome and all these other things as they affect mental health is so much more interesting and safe. It's like, gosh, you guys get it together, because this is terrible. It's just tragic.
Yeah. So this is a hard story. I think it's worth reading, and I wanted to bring it up because there are people that have non-responsive depression that doesn't respond to medication, so they are really suffering from depression or other psychological challenges. And ketamine has helped some people, but it seems like it has also been prescribed something like 10 times more last year than the year before. And that's just something for our listeners. We have a lot of providers in the audience. We have a lot of patients that take care of themselves and really are forward thinking. We just need to consider these things, that there are benefits to it, but there's also significant risks with it, like any medication, really. Okay, let's move into Web3. And so we have a couple different stories about the tokenization of securities in the world, really. But I'm going to start off with the block. The SEC and CFTC, the two big bodies, unveiled new crypto guidance. So they have clarified really almost the opposite of what the Biden administration did. They've been very explicit about what is a security that needs to be managed under the SEC and what is not a security that the CFTC will do. And so that's great. We now have clarity, and I think it's going to allow Web3 to grow much more quickly because there's clarity for them.
Right. Yeah.
What's your thought about this?
It's probably long over. It is long overdue. The Biden administration just took a very dim view of a lot of innovation, not just crypto, but also AI, or I should say they took the view that it needed to be proactively regulated. Generally when we regulate things, we wait for problems to emerge. We don't try and project what those problems are. Like with AI, it's nearly impossible to know, right? And anybody who pretends they do know, is really making it up. And but yet we have entire regulatory regimes being proposed that are supposed to, keep us all safe or make sure we're not discriminated against. So we don't even have evidence that those things are happening. So how do you come up with a regulatory?
Nor do we know if a regulation would prevent that from happening,
or make it worse. So that's that was kind of the position of the Biden administration. Here we have a much more free and easy approach. I'm excited about it because I've spent most of my career on Wall Street, and one of the things that I think is one of the things that's probably going to be really neat about it. Do you remember, Vic, during the 2021 period where we saw these SPACs come out of?
Yeah.
Okay, the stuff that was coming out via IPO, through a SPAC, it was some sketchy stuff, right? It was, it wasn't high quality issuance, but there are a lot of people who are okay with that. They're okay with playing that game. And so what I'm expecting to happen is the traditional equity markets, the trading on the stock exchange, NASDAQ, whatever, those things will be for the big dogs and the more traditional companies. And over there on the digital tokenized exchange, you're going to have, like the SPAC guys, although they'll be called something else. They're this is a little more edgy, a lot more individual investing decisions. Like analysts won't necessarily cover this, at least initially. And it'll be a ton of fun, because what's desperate need here is, better capital formation. We've got all these things clogged up in private equity. We have, in these, Series E rounds and in venture funds, and it's just stuff needs to get out. It needs to be liquid, it needs to be traded, and it needs to, meet its fate with investors. And that's awesome. It's so much fun.
Yeah, I agree. I'm not sure that it's going to only be the fringe, but it's definitely going to be it'll initially be more risky assets. But the next story, S&P 500 owner jumps into 24/7 futures for an index on crypto exchange. So the S&P 500 index, probably the most well-known and maybe the largest trading volume daily, is on the Spider and all the SP index transactions. And so now they are going to be listing perpetual futures contracts on Hyperliquid, which is a Web3 platform. And so you're going to start to get this migration back and forth, where there are maybe some Web3 crypto things that end up in public securities traded on NASDAQ or NYSE or in Texas or wherever. And then you also have these Web3 platforms like Hyperliquid starting to trade, one of the oldest indexes.
And that line between public equity securities, right? The granddaddies, the U.S. economy. Some people, which is crazy. That line, just starts to melt away, and you get this way more dynamic and creative environment, which we haven't had for 20, 30 years. Wall Street's been a fairly dismal place for 20 or 30 years. Part of that has to do with the fact that I don't think software as a service is actually supposed to be a public company, but I digress. In a technology world where companies like SaaS companies and so forth, I mean, the whole point of the public equity markets is to access capital. And why do you need capital? You need capital because you're building stuff. You need capital because you're acquiring physical assets. That's the original idea. And as the economy moves into this kind of virtual sphere, and has merged into the virtual sphere, the purpose of the public equity markets really became compensation. In order to have, liquid stock options for the employees that you wanted to compensate, not for the capital, not for the actual acquisition of things, or to build things. And this has been a contributing problem for the stock market, because, when you're moving, as the U.S. economy is doing, moving towards an emphasis on the physical world, mining, for example. Miners have been left for dead for 20 years. But as you're moving towards the importance of the physical realm, and you look at, all right, this company's got this much money on we've got these things on its balance sheet. It's got these capital assets. And you go and you look at a SaaS company, it's like, it's not the same, right? And it gets evaluated differently.
let's jump into AI since we kind of started talking about it. So the first one is a healthcare story, and then we have some general AI stories. So in Fierce Healthcare, Maven Clinic expands AI capabilities with genAI agent built on top of OpenAI and Google's LLMs. So they've branded it Maven Intelligence. Of course, Maven is pretty large women's health platform. And this is the beginning of a trend where I think companies are launching their own AI agents to sort of serve as the brand ambassador or the help desk or some combination of that. What do you think of this story?
Yeah, which is, it's a good use of the tool, right? To be able to
as long as it gives the accurate answers. Yes.
Yeah,
a woman being able to get an answer at 10 at night when maybe her doctor or her nurse practitioner isn't online is super valuable, as long as it is, the same quality. Or
right. And when you think, and I mean, I immediately go to, pre and perinatal care, right? Because, anxious mothers, in the middle of the night, that's exactly the solution you want. So that's great.
Yeah.
But yes, is the quality, good? Is it meeting that need, or is it meeting, some other need? So it has a lot of benefit. And when we talk about these AI platforms, and we did this with telehealth platforms, I always come back to something Senator Frisch told me when we were having this talk about telehealth, and he was recalling his father consulting with doctors in Putnam County via phone, at 10 o'clock at night. And he made the point, and it was a powerful one. It's like, you're the doctor, okay, but what you want in your toolbox is every modality you need in order to achieve your goals as a doctor, with the patient. And this is, an AI is going to be, I hope, properly deployed, will be one of those, just like telehealth is one of those. But it's only part of the picture, right? You still have to have that doctor at the center of it. And maybe technology people don't agree with me when I say that, but I think it's important.
Yeah, I mean, I think it's both ends. Like, it's incredibly valuable to have an online Maven Intelligence or any other brand name helping a pregnant expecting mother understand that whatever she's experiencing at 3 a.m. is not a crisis, and she can try to go back to sleep and call her doctor in the morning, or it does need to go to the emergency delivery department right away. And then hopefully Maven is sort of collecting that and doing checks on the quality, and there's a continuous improvement process there that gets better and better over time. That's the hope of it, at least. Okay, moving on to the fight between Microsoft and OpenAI. So OpenAI signed a $50 billion deal with Amazon, and Microsoft claims that is in violation of their contract. The dispute hinges on a definition of what stateless or stateful AI is that I'm not sure I understand, and we don't have Marcus here to explain it. But this is in the Free Press Journal talking about Microsoft looking to possibly sue OpenAI. What are your thoughts about this?
I don't know. It seems like everybody hates Sam Altman. Mm-hmm. He's got to be the least trusted person in technology. I mean, it's like controversy follows him around. And I mean, this is the same with, Dario Amodei too, where it's like, can you guys not just run a company? Like, why are you constantly, doing battles? I don't know the specific of the contract. And we always have to discount some sort of competitive strategy here as well. But I think the bigger issue here is that both Sam Altman and Dario Amodei seem to just constantly be in controversy, which is no way to run a business, ever.
Yeah, I think they are both in controversy all the time. And I think they have very different approaches, styles, and even cultures that they have fostered in their businesses. Anthropic is trying to be kind of white knight. We're going in very fast towards AI doing all kinds of things, but we have a conscious. They have the Claude MD file. They have the soul stuff. They're trying to do the right thing. Well, they are also running very quickly. And Sam Altman, I think, is much more the Silicon Valley ethos of the winner in market share terms will then write the history of how all this is done. And he's not so worried about breaking eggs or making Microsoft or someone mad right now. He's just like all out to win, move fast and break things was his Zuckerberg.
And I think the risk here is this, I'd say this is true of Anthropic. When you're talking about Microsoft or Amazon, you're talking about seasoned leaders, massive companies with extraordinary amounts of talent on which they can rely, tons of experience, and thinking, well, I can treat them poorly or I can treat them any way I want because that's somehow, because you're somehow going to be as important or as big as they are one day, is a mistake that's been made many, many times. And it doesn't usually end well because where even though like maybe a Microsoft is behind, the curve a little bit on AI, they have the capacity to catch up very quickly. And so it's like I said, I've seen this a lot over the years, and this is not it usually ends poorly, but we'll see.
Well, I mean, the way I would think about it as an investor is the stack, right? So if you, like, for instance, Google has the entire stack, right? They have the LLM model, they have the agent and the applications like Gmail and Docs where the model's being used. Then they have the cloud systems, the actual data centers. Then they have the chips that they make themselves to go into the data centers, and they have all the scientific team creating the next thing. OpenAI doesn't have that entire stack. So they're trying to, the deal with Amazon was trying to offset a risk in the data center space because they don't have access to enough of that. And I understand that. That is a very competitive, like strategic challenge they have to work through. But you're right in a sense that Microsoft has a lot of attorneys, and my money would be on they understand the contracts, and OpenAI maybe was trying to push on an edge that maybe is going to get back to bite them.
Well, and let's face it, Vic, Silicon Valley, large parts of it, made their name for themselves by stealing, by taking things, from other people, starting with Microsoft. And
okay, so let's unpack that a little bit, because that's a big statement.
Well,
so
I mean, you go back to Microsoft's antitrust, lawsuit. Okay. Go back to the data scraping of, where, Google search, you were the product, Amazon, putting up, replacing product from sellers with their own Amazon Basics product, which looked a whole lot like the product seller's product. I mean, this is kind of a shocking tradition, actually, in Silicon Valley.
As a venture capitalist, I can't help but even though I don't live in Silicon Valley, I think the ethos has been drive value to the end customer.
Right.
And let's take Uber, because that's an better example, easier example. Uber launched, and it was built on top of GPS and mobile and Stripe for payments. It wouldn't have been possible to do that in 1997, but in 2007 or whenever they started, it was possible. And yet it was in violation of very many geographies had taxi laws that had been on the books for decades that prevented individuals from being paid for giving someone else who's not related to them a ride.
That's correct.
in direct violation of that. And Uber's decision, and I think this is sort of the ethos in Silicon Valley that you're talking about, was, well, their laws are wrong. Like, we are bringing a solution that people want, and the drivers want it, the riders want it, everyone wants it, and we are not going to let it be sort of captive by these regulatory problems. And that's sort of the culture that they put in place. And they had their drivers and their riders calling, city councils and trying to get it changed, all coordinated, by the way, by some people that I know. But that was
Me too.
that was a process that has been repeated many times in the Valley about like getting the value, getting this technology out to the people that can benefit from it, and changing the laws that are required to be changed before we get in, through the court cases.
Uber went to got Bradley Tusk to help and went to the Traffic and Limousine Commission in New York City and got approved. I mean, they went through the regulatory process. Did they do it after being told to? Yeah, they did, but they did that after. I'm distinguishing here between pressing the regulatory envelope and some of the things that Amazon did, which is you sell your little widget product, and lo and behold, it shows up as an Amazon Basics product, and you're demoted down the page. There was common practice for Amazon in early days. I think they've given that up, but there's.
I think there's a distinction between what is illegal and what is maybe not very friendly. I don't think Amazon did anything illegal, but there were a lot of small businesses that suffered because they were very aggressive competitors. Say
right. Well, the whole so Sam Altman has that. Let me just go and take it. It's mine kind of thing going, which I think is contributing to his reputation. And maybe that works out. I don't know. But if you look at the history of innovation, incumbents, challengers like OpenAI, that's not who's going to win the game. It's going to be probably Microsoft, or and Google, who obviously is just going gangbusters. And that's the history, whether we like it or not. But it's definitely I think Sam Altman just probably needs to be a little bit more wise about some of his choices here. Is probably and I would say the same thing to Dario Amodei as well.
And then we're going to end with this. Val Kilmer passed away, but he has been resurrected by AI to star in a movie, As Deep as the Grave. And so I thought this was a great story to end on. We now have our first Hollywood actor who has been resurrected by AI. Now, to be fair, he agreed to do this movie before he got maybe throat cancer. He got some kind of cancer.
Throat cancer,
do it.
Yeah.
And so for his estate, it was a much easier decision because he had wanted to do this part. I think there'll be, more complexity with a new script that who knows what the actor would have thought with his name and likeness. But the point is that technology is ready. Now, I haven't seen the movie. It's not out yet, but it seems like we're changing.
You start to wonder, who's the actor, right? What is acting? And it's funny because, who's really pioneering a lot of the thought on this is Matthew McConaughey. Matthew McConaughey has said, I am trademarking, branding. I'm locking myself down, so that you have to pay me, or my estate, to use my image and my voice and, the whole bit. And he's kind of been running a lot of the thought leadership on that. Which is wise because, likeness and image and voice are an area that is like the low-lying fruit here when it comes to AI AI regulation. We get all worked up about the jobs thing, which we don't even know how that's going to turn out. But the real and present problem is the use of an image or a voice to do things that are illegal or wrong or reputation damaging or what have you. So the market looks like it's kind of coming in and going, all right, here's how we're going to do it with Matthew McConaughey's work, and this with Val Kilmer's work. But I'll just note that, did you see the movie The Irishman?
I did not see the movie The Irishman.
Yeah. The Irishman was about Jimmy Hoffa and his ultimately his death. But Jimmy, they did so much work, digital enhancement on Robert De Niro and the other actors to make them look 30 years younger. Right. So the Robert De Niro at the Academy Awards, is a very different looking Robert De Niro than the one that was in the film. So
he was walking through the blocks in the scene, but CGI was covering a lot of that human to make the movie look right.
That's exactly right. So it's
and I mean, I think for the regular people that aren't actors like me and you and our listeners, it makes me think, I can't believe what I see or hear today. Like, I mean, we were talking about Sam Altman. When I saw the video of Sam Altman stealing a memory card from Target, which was a faked video, they faked it with the OpenAI Sora platform, just as a joke. But it looks realistic. And so if you are accused of something, it could have been you. It could have been a fake. It's really difficult. I don't think it's possible to tell anymore right now.
I don't think it is. And one of the things that will have to emerge, and it did in the early 20th century. Newspapers, it was called yellow journalism, muckraking, and stories would appear in the 3 or 4 competing newspapers in New York City. And they would say stuff that very frequently wasn't true. And over time, what became very clear is that a newspaper had to emerge out of that, or newspapers had to emerge out of that were trustworthy. When you picked up that newspaper, you knew that information was accurate and complete and correct. And that was kind of the role the New York Times, assumed for a long time until sadly recently. And that's where the money will be made, is being that trusted source of information that people can rely on and go, okay, this is true. Because I'm like you, if I see a video or if I see something like, the FDA commissioner said this, I don't go and look at the newspaper to see if that's what the FDA commissioner said. I go and look at the press release to make sure that's what he said.
Right.
That's where we are. I'm a primary source girl now.
Yeah, you have to be. And I think it's going to get worse before it gets better. We do, if someone can create, trust is the most lacking resource, the thing that is most scarce right now. And if one can create that, then I think you could make a lot of money, and it's really valuable. But how to do that is the question right now.
It takes more work than anybody wants to do right now, but it'll happen. I mean, it happened in the early 20th century. It'll happen in the early 21st century.
Great. Well, thank you, Emily. I appreciate you filling in. We covered a lot of ground.
I'm glad to do it.
Yeah. Hopefully we'll see you at our summit in a couple of weeks.
I am looking forward to seeing you at the summit in a couple of weeks. And I'm glad to be here, and I'll look forward to another conversation soon.